So let me just. So hello everyone. My name's Catherine Neck, and I'm Macmillan Cancer Rehabilitation Lead for Avon and Somerset. Part of my remit has been to look at setting up physical activity programs across the region, and we've set up Revitalise, as most of you may be aware of, in Somerset. And the purpose of this webinar is really to give you a bit of background about physical activity and cancer, and the initial bit a bit about some cancer awareness. So just to start with, I'm just going to click my slide. So hopefully everybody can see my slide, the slides on there. If anyone can't, just raise it on the chat screen or shout. So the initial background really is that one of the reasons for this is we've got more than 2.5 million people living with or beyond cancer in the UK currently, and that figure's forecast to rise to more than 4 million people by 2030. So that's a huge number of people. In 2012, we had almost 340,000 people diagnosed with cancer in the UK, and over 160,000 people died of cancer. And we know that by 2020, almost 1 in 2 people in the UK will develop some form of cancer during their lifetime. Oh, Stephanie. So we also know that developing cancer depends on many factors. They include age, lifestyle, genetics, but more than 40% of all cancers in the UK are linked to lifestyle factors, including tobacco, alcohol, diet, being overweight, and inactivity. So obviously physical activity is a big part of all of this, but physical activity also protects against several cancer types, independently to its effect on body weight. So I'm just going to move on to the next slide. So this is it's a short video from Macmillan about basically what is cancer. So it's quite straightforward, but I thought it'd be quite useful to be able to have a look at some of that. So I'll just play it, and hopefully the technology will work. Okay, I'm just going to go back to the original PowerPoint. So just the next slide's really talking about some of the things that physical activity has an effect on with cancer. It can help to reduce the consequences of treatment, and these are really the sort of negative side effects that people can experience after treatment. Now, there's lots and lots of these, but one of the biggest reported consequence of treatment is fatigue, and that's reported to be experienced by about over 70% of cancer patients. We know from the research that physical activity has a significant effect on fatigue when it's done in a sort of controlled way, so looking at sort of gradually getting people more active. We know that physical activity has a positive effect on mood, anxiety and depression. Psychological stress is reported by 25 to 30% of cancer patients. And we know from studies that physical activity can lower levels of depression and anxiety. We also know that physical activity improves cardiorespiratory function, so heart and lungs, get them working better, helps to improve muscular strength and endurance, and also has a positive effect on bone health, so which includes osteoporosis. Lots of patients who've had cancer, particularly premenopausal women who've had breast cancer, have an increased risk of osteoporosis, and also men who've received hormone treatment for prostate cancer are at risk as well. So again, we know that bone, actual loading intensity exercise, so weight bearing exercise, helps to improve or help to manage osteoporosis. Physical activity can help with the management of lymphedema, and also have an effect on helping with things like constipation, which is again common following certain kind of cancer, particularly bowel cancers and other similar cancers as well. And body physical activity, was, as you know, helps people prevent weight gain or help them with weight loss. And also a lot of people, particularly ladies with breast cancer, report significant weight gain, men with prostate cancer and bowel cancer as well. So again, a lot of cancers are often treated with steroids, and that can have an effect on people gaining weight. So it's just kind of quite a bit of a quick overview really of some of the consequences of treatment. We know that 1 in 2 cancer patients has another chronic condition, so that could be heart disease, lung disease, kind of diabetes, chronic kidney disease, things like that really. And we know that physical activity reduces those comorbidities as well. The kind of very interesting research is around physical activity reducing disease progression. So people who've had cancer, and I'm going to go into this in more detail, the physical activity at certain levels actually helps to actually reduce kind of the effect of cancer coming back. So again, that's kind of really important. Another reason why people should be more active following their cancer treatment. And obviously, if they're less likely to get cancer recurrence or disease progression, their risk of mortality decreases as well. So again, there's lots of evidence behind the need for physical activity, and kind of more so than maybe in some other conditions that you may have come across as well. So this is a really important message. So exercise is safe, both during and after most types of cancer treatment. I'm going to another slide in a minute which talks through some of the safety issues around physical activity in cancer. But again, we know that we want to encourage people to be more active. We don't want people to be sedentary, both, as I say, during and also after their cancer treatment. And this is the complicated slide, and I'll take you through it quite slowly, partly because I need to think about it as well while I'm talking it through. So to start off with, we've got the effect of basically the physical activity actually on the cancer cells, and also immune systems and hormones that make up the body, and are kind of important for cancer spread and cancer development really. So we know that the body's chemical environment changes after exercise, and although we don't understand completely how the anti-cancer effect happens, we think that one of the most likely mechanisms is around growth factors such as insulin-like growth factors and proteins, and actually the physical activity actually having effect on those proteins themselves. So again, so we've got things like on the cell growth regulators, you've got a couple of examples of the molecules involved, and physical activity actually can decrease the levels of the IGF-1, which helps to prevent cancer, but also The other one has a reverse impact, so the IGF-BP3. So again, physical activity increases levels of that, so it can actually affect how cancer cells grow, to prevent them growing, which is quite interesting, in terms of actually working at a cell level. Physical activity has also been shown in with certain proteins involved with DNA damage and repair. So again, these genes, the BRCA1 and the BRCA2, so again, the physical activity increases the expression of those genes, which effectively makes them repair themselves better, and actually helps to prevent cancer in that respect. With different types of hormones, there's many cancers that are linked to increased hormone activity, gynecological cancers, breast cancers, prostate cancers. So again, physical activity can help to decrease the levels of those hormones, which again can have a positive effect on people, having cancer recurrence in the first place. And then also finally the immune system, which again is the body's way of fighting disease. Again, it can help, physical activity enhances the activity of the immune system. So again, this is actually helpful in the body being able to fight cancer cells themselves. So although it's quite a sort of technical slide, I mean that the kind of underlying message is really that physical activity actually has an effect at the cell level. So it's not just about kind of making people feel well and that type of thing, but actually, actually at a biochemical level, being able to actually improve your chances of cancer not reoccurring. So just moving on to the next slide, and I appreciate that people can't respond back very easily here, and I'm sure I'm probably preaching to the converted here, but this is just really just asking people what your thoughts are about what the Department of Health guidelines are about the amount of physical activity that you should do each day and each week. And so the actual, again, I'm sure a lot of this is very familiar to you, but the UK physical activity guidelines, and this is for the people being 19 to 64, so trying to ask people to be active every day, aiming to accumulate 150 minutes, so 2.5 hours of moderate intensity physical activities in bouts of 10 minutes or more. So again, the old guidance was 2.5 hours a week, but actually in bouts of 30 minutes or more. So they've broken it down into sort of more manageable amounts of time for a lot of people, for partly lifestyle, but also very much with health conditions in mind as well. Exercise to improve muscle strength on at least 2 days of the week is important. And the guidelines around older adults are talking about if people are at risk of falling, to use exercises to improve balance and coordination. So again, things like yoga, Tai Chi, Pilates, those sort of types of exercises are important to prevent risk of falling. And the underlying message is really about avoiding sedentary behaviour. So again, it's stopping people sitting for long periods of time, lying for long periods of time, going back to that idea that we want people to just be generally more active. Now, the reason for putting this slide up is you're probably thinking, well, what does that mean for people affected by cancer? Well, it's basically because the guidance really is no different, quite honestly. We want people to be more active at different points in the pathway, to be active in different ways. So while they're undergoing treatment, we want people to try and be as active as possible within the limits of their health and well-being and their ability to cope with treatment. But when they finish cancer treatment, we want people to build back up to these guidelines, these UK physical activity guidelines, because they're what, we know, they're research to show that these are the healthy guidelines for people to get back to. So that's really what we're trying to strive towards. Again, the coordination and balance thing is, as well as kind of maybe older adults at risk of falling, cancer patients can experience things like peripheral neuropathy, so pins and needles, loss of sensation, numbness following chemotherapy particularly. And obviously if that's happening in their legs and in their feet, their balance can be quite significantly affected. So again, it's very, very relevant to get people to do those sort of strength and coordination exercises. And again, with the sedentary behaviour, again, we know that not everyone's going to get up and go to the gym and do classes and what have you and things, but if they're at least trying to be more active in their daily life by getting up and walking a bit more, not taking the car, doing the stairs, that sort of type of thing. Again, that's, we know that's really beneficial and doesn't have to be life-changing for people. It can be things they can do in their own daily life. And then just moving on, I mentioned that when we talked about the exercise is safe slide, this is a bit of work that's been put together by physiotherapists who work in oncology, and it links the sort of key symptoms and issues that people might have and how you might want to monitor and modify their activity based on that. So for people suffering from pain, fatigue, nausea, breathlessness, you're wanting to try and kind of again just modify the activity based on the site of treatment. So the example there is saying avoid exercise bikes after prostate surgery certainly for the first, I would say probably the first 3 months after prostate or rectal surgery, because of the risk of damage, of impact of being on a bike seat. So again, that might be something which is you come across quite readily, because I know I get quite a lot of queries from people who've had many have had prostate surgery and saying I'd like to get back on my bike. How long can it be? And it is important that they hold back on that for a good 3 months post their surgery, so that it gives their body time to recover. And again, if people are experiencing a lot of pain or fatigue or nausea, you wouldn't want them to be doing high intensity exercises during those episodes. So they'd just be kind of taking it back a bit, taking it slower, maybe lessening the intensity, lessening the amount they do, so that they can cope with those symptoms better. Fatigue's an interesting one because I mentioned that there is research to suggest that exercise improves fatigue. But what we find is the lower impact activities like yoga, Tai Chi, Pilates, those sorts of types of things, gentle walking, building up tolerance to exercise is a really good way to go, so that they can kind of build up their activity levels, but also help to manage their fatigue at the same time. With anemia, so this is low red blood cell levels in the body, which again is a side effect when people are often on during cancer treatment, particularly during chemotherapy. You wouldn't, because they're more at risk of bleeding and having blood loss and things, you wouldn't want them to be doing moderate to vigorous intensity exercises until their blood counts are back up to normal. Now, any patient who's actively undergoing chemotherapy is given all of this information, so you wouldn't be expected to kind of be, instigating this. But if people are saying they're actively on chemotherapy, it's always worth saying to them, what's your blood count like, so that we know that they're, not putting them at any risk with anything higher intensity level. Similarly with infection risk, again with chemotherapy, because it sort of attacks the whole of your body, if you like. So we call it something called a systemic condition. It doesn't just attack the cancer cells, it attacks other cells. So it can often reduce people's immune system and means that they're more likely to get an infection. So again, we advise people not to be exercising in public spaces if they are immunosuppressed and their blood count levels are low, because there's more risk of infection. Similarly, we wouldn't advise people to be swimming whilst they're doing their chemotherapy for the sort of levels of bugs and things that might be in the changing rooms, in the pool, all of that sort of thing. So again, people are advised about that to avoid the risk of that if they're immunosuppressed. When people, again, mentioned about balance and coordination and falls risks, and again, I guess it's quite self-explanatory, but if someone has got significant balance coordination problems or risk of falls, you'd be very careful about putting them on something like a treadmill or a bicycle, something where they might fall, or getting them to do sort of exercise that puts them at risk of falling. Similarly, people may have dizziness, maybe quite frail, have the peripheral neuropathy that I talked about earlier. So again, building them up with muscle strength and balance and coordination exercises is important, but just doing that, in a safe way, in a way where they're not likely to fall while they're doing the exercise. People who have either have bone metastases, so that's secondary cancer that's spread to their bones, and that puts them at higher risk of having a bone fracture, or if they've had treatments that make them at risk of osteoporosis, again, you wouldn't be wanting them to be doing high impact contact activities, so contact sports like rugby, football, that sort of type of thing, or jumping, those sort of types of activities, things like that. But there is evidence to say that keeping people walking, keeping people doing weight bearing exercise is important. So walking, that sort of type of thing, that sort of activity and things like that in the gym, where you haven't got that kind of impact loading, but actual strengthening exercises that actually help to improve bone density, or that can be incorporated and can be quite important. If people who have got a stoma, so a bag to collect either urine or feces, depending on if they've had different types of either surgery or sometimes radiotherapy to their pelvis, they may have a stoma as a result of that. And again, there's a risk of herniation around a stoma site. So you'd want to start off with quite low resistance exercise. And just gradually progress that slowly, so that you allow the body, the area to strengthen, the muscles to strengthen up around that gently, rather than kind of adding anything too severe into that, so that may actually cause a hernia. And finally, lymphedema, which again a lot of people may well have heard about. And there's lots of sort of myths and things around lymphedema. So this is where lymph nodes have either been removed or have been damaged by cancer treatment, and people are at risk of developing kind of big, heavy, swollen arms and legs as a result of that. And people often then find it quite hard to use their limbs to do things, but also people can be very protective of their limbs and actually then don't want to do anything with them. And what we say is that people who are at risk of lymphedema, so they've had lymph nodes removed or they've had lymph nodes damaged, but they don't actually have lymphedema, we want them to prevent getting lymphedema. So starting off gently with resistance exercises, to strength exercises in small and gradual increments to build up the strength and things, and the use of their limb is really important. And if people who've got established lymphedema, you want them to avoid repetitive, strenuous exercise with that limb, but actually, and they should be, or they're often, especially for arms, given a compression garment to wear, and they should wear that when they exercise. But actually, getting them to use the limb normally and getting them to do normal exercises with their compression garment on is really important, because that helps with some of the drainage around the limb itself. So that's just some of the key safety principles that we adhere to. But largely it's is very safe kind of to be doing physical activity following during and following cancer treatment. Now, hopefully this will work, this clip, in terms of being able to hear it. So this is Robert Thomas is an oncologist that works down in the south of England, and this is just a clip discussing from a medical point of view the benefits of physical activity during and after cancer treatment. Okay, so that was just from a medical point of view, very much kind of what we want people to do. So very much really echoing that is this statement to ensure that everybody living with and beyond cancer is aware of the benefits of physical activity and is enabled to choose to become and to stay active at a level that's right for them. So it's about finding something that people want to do and helping them feel confident enough to be able to start doing something and then pick that activity level up and maintain that activity, because that's really important. And I've just got one more video clip to show you. So this is sadly this is a gentleman called Ted Poulter, who's worked with Macmillan for a number of years. Sadly, Ted passed away last year. He had a very rare form of cancer, incurable cancer. This is a statement that he himself said. So keeping active has helped me and my family through a really difficult time. It's helped me return to a more normal way of life and has given me a real sense of achievement. And now the video clip I'm going to show is basically how Ted describes how being active has helped him before and after his cancer treatment. So again, just going to click into that. So that was the lovely Ted, and I had the privilege of meeting Ted a couple of years back and things. So very lovely man, and very good advocate really for why being active following cancer treatment is important. So this is just some of the slide. This slide is really just trying to show that this is taken for people who were affected by cancer and really trying to ascertain really how active they were. So the first bar is saying that some people are active enough to recommended levels, so they are, those 150 minutes a week guidelines. So that's roughly about 23%. About 46% of people are active to some degree, but not active to the recommended levels, not to the 2.5 hours a week. And just over 30%, 31% would be classified as inactive. The figures aren't dissimilar to the general population, but obviously highlighting a need here for us to get the message across to get people more active. And again, this is just looking at the relative risk of death as a result of being sedentary, so kind of sitting around a lot, lying down a lot. So for people who are spending between 8 and 11 hours a day of sitting, their risk of dying increases by about 35% over someone who isn't sedentary. And the sort of lighter green colour on the right hand side is the stats for someone who spends more than 11 hours in sitting. So again, we're talking about over 50% risk increase of dying as a result of the fact that they are sedentary. Now, these figures aren't cancer specific figures, so these studies were looked at in health outcomes amongst older adults. So, but again, that we know that the evidence can be extrapolated and kind of applied to both cancer patients and non-cancer patients, and again just telling us why we shouldn't be sedentary in our lifestyles. So this is an interesting question. So do adults change their lifestyle behaviors after a cancer diagnosis? Well, the answer to that is yes and no. So for people who smoke, then actually we find that, I haven't got on, that actually about 40% of people will stop smoking as a result of a cancer diagnosis. But actually we know that that isn't necessarily the case for people exercising. So actually 30% less people, or 30% of people exercise less as a result of a cancer diagnosis. So we know that people don't just change, and actually they're more likely to become inactive following a cancer diagnosis. And I think a lot of this is around the old kind of way of thinking about cancer, that rest is best and you must stop doing things and you must take to your bed and you must be looked after. So people follow that. Yeah, if they think that smoking contributed to their cancer, they're more likely to go, oh, actually, yes, I'm going to stop smoking. So, but what we do know about cancer is that there's this thing called the teachable moment, which again you may have come across in other fields. And again, it's a point in time where someone is more likely to alter their lifestyle and health behavior as a result of something that's happened. And what we know about cancer is there's a significant teachable moment at the point of diagnosis, or at the thought that they might have cancer. So at the point where they might have seen their doctor and they get referred to go and see a cancer specialist. There's a key teachable moment here about behavior and lifestyle change that we can actually harness and take forward, really, to help kind of people change their behavior for the better. So we know that people can change their lifestyle behavior following a cancer diagnosis. So that's either the giving up smoking or exercising less. So either way, but actually, if they are given advice and support and encouragement from some form of professional, so that could be a health professional, that could be an exercise professional, that could be anyone in that kind of sphere, they're more likely to change than to do it on their own. So again, this is kind of what I'm building up to, this kind of point that we've all got a role to play in kind of supporting people to improve their lifestyle behavior following cancer. That's it, jumps through. So we've got the Ask, Advise, Act, which is something which, again, you may be familiar with. So it's around looking at behavioural change, around kind of becoming more active. So what we're saying is you can make a difference to someone's behaviour in just 60 seconds, depending on how you actually, have those conversations with someone. So again, it's not about telling people to change, it's about working with them to actually get them to decide for themselves that they need to change. So just looking at each of those kind of points in each bit. So whether you'd actually say it like this, but the ask component is, you know, things around saying to people, do you know there's evidence that physical activity can benefit people affected by cancer in many ways? So, I mean, you could break that statement down into, you know, specific issues that people might have, and saying that actually there's evidence that physical activity can help you with fatigue, can help you with being, if it's someone who's just been diagnosed, with kind of coping with the effect of treatment and feeling fitter and stronger and being able to get through their treatment a lot better. So again, it's just asking them in that respect rather than telling them that you must do this, you must do that, which we know that people don't you know, respond well to that type of approach. And then the advice bit is kind of going into more detail. So going into the kind of what are those benefits? So again, you can be very specific here, or you can be more general depending on the person you're working with. So you might be talking about strengthening up muscles, joints, bones. It might be about improving looking after your heart. We know that cancer treatments, that a radiotherapy around the area in your chest and things can have a negative effect on your heart muscle. Obviously, we know it helps improve your mood and quality of life, helps you maintain a healthy weight. So all of those things, those factors, those kind of things that, you know, kind of people might be able to relate to and actually think, oh no, I don't want to be, you know, overweight. I don't want to have a damaged heart. I don't want to have lymphedema. You know, these are the sort of reasons why you want to be advising that exercise is better. And again, you know, trying to, you know, reassure people it's okay to start slowly, that you don't have to be, you know, jumping in and doing a vigorous exercise class, or, you know, vigorous activity or a sport to start with. You can start gently, you find something you like, and you can build up gradually. And that's really important for people. And then again, the ACT bit, I mean, the stat, these are obviously Macmillan have written these slides and I've just sort of adapted them for this use, but they're talking about, you know, would you like more information, which again, you would be something you could ask people, but you would probably be looking at tailoring the support that you give people to what's available locally. So they talk about and which is absolutely fine, is the Macmillan site around physical activity. It's an absolutely excellent resource for people. The Move More guides and the actual research resources around that. The Macmillan support line is also a really good resource for people, not just around physical activity, but anything to do with cancer. But this next slide really is about, which again, hopefully you're familiar with. So, you know, this is where the signposting to something like Revitalise comes into its own, because actually this is here, you know, people in Somerset, if you live in whichever part of Somerset, there's these things going on around you and near you. On the left hand side, you've got all the different types of intensity of activity, or the things that it can benefit, you know, so you've got calming body and mind, energizing hearts and bodies, gym fitness, walking, one-to-one appointments. So again, there should be something really for everybody, and that was the beauty of Revitalise, and why we really were so glad we set it up, because it's not just a gym program, it's not just a particular type of activity, it's something that anybody can do. And again, it's not something that is just open to people who are affected by cancer. It's actually for friends, family, anyone that can come along, because we know that, you know, people are more likely to do something if they have someone to go with them, but also that person probably be benefiting just as much from going along as well. So, and obviously again, Somerset being such a big county, it's fantastic that we can offer Revitalise in so many different venues and also with different activities on offer. So again, so people aren't having to travel, you know, significant parts of that, you know, they haven't just got to go to Taunton or go to Yeovil to access these sorts of things. There's things more locally for them. And that's the sort of thing you'd be, you know, hoping to kind of advise people to do and kind of signposting people to do. And then, you know, people then will find hopefully things in their, you know, local town or village that they feel confident to go on and do. So they might start off with going through Revitalise, but then think, actually, I feel that I could go and take up that dance class which is going on down the road, or, you know, or there's an activity group here, because we know that, you know, the kind of social interaction around being active is so important as well. So it's getting people out, meeting people, interacting with people, stopping people getting lonely, isolated, and there's enormous health and social benefits as a result of that. So we want people to feel confident to be able to go and be active and be part of their community as well. This is just the screenshot really of that Macmillan kind of maintaining a healthy lifestyle page, which you can find from the link on that couple of slides ago. Lots and lots of fantastic information. So this is the keeping active section, but as you can see on the left hand side, you've got some information around healthy eating, preventing weight loss, managing weight gain. There's really good recipes for people, getting, and stuff that's really quite straightforward to do as well. So it doesn't have to be, gourmet cooking and everything like that. Because if anything like me, I keep things to the basic. Information about keeping active, information about giving up smoking. There's some other videos on there about what other patient experience around becoming active after treatment. There's the link to the Move More guide, which is absolutely fantastic resource that it's free for people to order. It's got lots of useful information about safety information, about how to get started with being active. There's a DVD in there which has 2 home exercise programs within it. So one is more seated based and one's a more standing based exercise. So again, for different levels of ability really. But again, that can just get people started. There's activity diaries in there, and it is a really absolutely brilliant resource. So we advocate that, people having that as a general resource anyway. And then obviously, the more specific things that are available to people locally. And then so that's just the it's not a great picture, I'm afraid, just of the Move More guide. So it's like a little booklet, but it's sort of like a wallet thing, and then but the little booklets slide into it. So it's again an A5 piece of A5 sized booklet, and again you can order these free off of the Macmillan website, and they literally come within a day or two of ordering. So you can order as many as you like for people affected by cancer that you're working with. And again, these are that's just some of the links to the Macmillan website. It doesn't just, if you are interested in finding out more about cancer, it has absolutely everything that you could possibly need to know. So it has sort of A to Z of the different cancer types. It has what are the different types of treatment. It talks about lots of the side effects of treatment and kind of how to cope with those sorts of things. Coping with things like fatigue and coping with diet issues, coping with anything and everything really. It's an absolutely amazing resource. So if you get a chance, have a look. And again, if you're working with someone affected by cancer and they're saying they're having issues with certain things, then you can signpost them to that. You can signpost them to the Macmillan support line. All those sort of things are really useful for people. People might be having financial issues. There's lots of information about work and finance, which they can get, and they can get information from the benefits service. So again, it's very, very broad because the consequences of cancer treatment are very broad. They're not just physical things. So again, it's a really useful, it's a point where that you can signpost people to, because there's always, people, they always, they think something's wrong or they're not sure. They go onto Google and they may not necessarily get sort of, information that's evidence-based and that's actually accurate and things like that. So, this is a website which gives you evidence-based, accurate information about cancer and its effects really. So. And other sort of similar ones would be the Cancer Research UK websites, things like Prostate Cancer UK, Breast Cancer Care. So the kind of ones that are from charities and things that are reputable, those sort of sources of information are really important to give to people so that they avoids them kind of looking up stuff a bit randomly and kind of coming up with things that aren't particularly helpful or maybe even harmful to them. So because again, you will find people that want that bit of extra information around things. But that's the general links there to the Macmillan information. So again, I don't know if anyone had any questions. I know because this is being recorded and so people will have the chance to kind of watch this at another time as well and then come back to me with any queries. I'm not sure what the best way of if I basically tell you what my email address is, that's probably the best thing, although you can get it through the SASP team. So through Jen Slade, she's certainly got my email address, but it's Catherine.neck, and that's CATHERINE.NECK at N, that's North, and B for Bristol, and T, which is trust, so North Bristol Trust, nbt.nhs.uk. So I'm very happy to take any queries that people might have. I'm a physiotherapist by background, which is why I'm kind of been, this is one of the reasons why I'm so interested in physical activity and cancer. And hopefully this has been useful for you today, and hopefully you'll feel a lot more confident with working with people affected by cancer, and knowing that you really can make a significant difference, and that it's still very, very safe, and it's important, so important that people do get active again. So I hope that's been helpful to you. Thank you for listening, and hopefully people will find this useful as they can listen to it in the future. So thank you. Thanks very much.